One of the biggest tech blunders this year wasn't a glitch, it was an algorithm trying to be helpful. A health system AI designed to flag high-risk patients decided the smartest way to figure out who needed help was to look at your past medical bills. The result? If you were part of a marginalized community that has faced decades of inequitable healthcare access, meaning your medical costs were historically low, the algorithm beamed and said, "Great news, you're basically immortal. Off you go." It mistook a history of neglect for a clean bill of health. It's not malicious. It's just spectacularly dense. This magnificent failure of logic is right out of the playbook of Shirley Jackson. In her story, The Lottery, every June, one person in a seemingly normal small town is randomly selected and stoned to death by their friends and family. When asked why, the villagers barely remember, shrugging and saying the quiet rhyme, "Lottery in June, corn be heavy soon." The genius of Jackson is that the system is terrible, but everyone is so busy and polite about the efficient ritual that no one bothers to stop it. Our modern algorithm is even better at this absurd bureaucracy. It looks at the historic injustice, the low-cost data that screams, "We miss these patients," and simply automates the conclusion. It looks at the historic data of inequality and treats it as the baseline. It finds the quietest patients, the most neglected needs, and efficiently says, "According to my records, you're perfectly healthy. Next." The algorithmic lottery is drawn every time a patient walks into a clinic. We have traded the cruelty of the stoning circle for the cold indifference of the machine. The math is clean, the paperwork is flawless, and the injustice is now perfectly scalable. Another victory for artificial intelligence. If you find yourself questioning the logic behind the automation of this obtuse indifference, subscribe to Litriff for the next chapter where literature meets the headlines.